Hello, I'm Dr. Paul Beckham from All Seasons Full Body Chiropractic Center. Here today we're going to discuss prescription foot orthotics and migraine headaches. These just happen to be a few things, I guess, that have cropped up in the office just over this last week, and want to make sure that we covered that so that if there's anybody out there that's interested in any of the topics here, we can hopefully cover what you're looking for. Please, if you have any comments or questions, just leave them as we go here. So one of the big things that we deal with in the office here is the biomechanics of a person's body, which if we look at a person's body, we're looking at the full kinetic chain, which starts at your feet. If we were to go back about 100 years ago, nobody would really need orthotics at all. You would just need your feet to walk around. You're walking on uneven surfaces. And your feet are made to adapt to walk on uneven surfaces. But the problem that we run into probably over the last 100 years or so is that everybody now is walking on very hard, flat surfaces. There might be carpet or some kind of material on top of it, but the surfaces are pretty consistently flat. And what ends up happening, if you don't have the proper support from your shoes or insoles in your shoes, you're literally going to end up having problems with your feet. If you've maybe injured them before, could have a little bit extra weight on, and that's going to end up stressing your feet more. You have high intensity activities that you're doing, even sports. You think of different sports that patients are in, as far as basketball, volleyball, tennis. Those are probably some of the worst ones for feet. You're running around on a hard, flat court surface. You're putting somewhere between 5 to 7 times your body weight onto your feet, and it's very easy to end up with foot problems in any of those sports. The orthotic company that we make prescription orthotics for literally can make orthotics for any of those sports, and all the way down to orthotics, I guess, to kind of explain, orthotics for basketball, volleyball, and tennis are going to be very more on the rigid end of the spectrum. People that have more arthritic feet, diabetic feet, those are going to be closer to almost like a pillow, but they will have some supportive material in there as well to help biomechanically correct whatever areas that the person needs to have corrected, so that just long term we can keep the proper alignment to their feet, which also then helps through the rest of the kinetic chain, including their knees, hips, spine and pelvis, up to their shoulders, head, and neck. Hi, Zach. Nice that you can be joining us here today. Kind of getting back to the orthotics here. In our office, I guess the biggest thing that kind of differentiates what we do is that we're going to go through a full foot evaluation with the patient. We're going to literally usually take a pre-scan. We have a digitized foot scanner where people will walk across. We'll see what their feet look like biomechanically. Then we'll take them through an exam. We'll also get their feet adjusted. Your feet are pretty intricate. You have 26 bones and 33 different joints. So we want to make sure that we get all those lined up correctly, because if you would happen to need prescription orthotics, we're going to want to make sure that your feet are in their normal neutral alignment, and that the orthotics are correcting everything and holding it in that normal neutral alignment. This is where generally other places that orthotics are getting made, they are not doing this at all. They're not getting your feet adjusted. You're literally getting an orthotic made for your foot when it's in a bad position. So you go to, there's several stores around town where I've seen foot scanning types of devices, and yeah, it's going to measure it for your foot, but you have to realize if your foot's not in its optimum position, you're now getting an orthotic made for your foot in a bad position. So is it going to help you? Maybe, maybe not. It's somewhere in between about a 40 to 60% compliance there for people that get an orthotic made if they're not physically having their foot adjusted and put back into the proper alignment, so that you are getting an orthotic that is going to help, help maintain that proper alignment there. So
yes. So I'm wondering, I'm somebody that wears high heels a lot. And so when I think of orthotics, I think ugly shoes.
You think ugly
Do
shoes?
we have to wear ugly shoes?
Everybody has to go
orthotics?
out and buy the Velcro. No. Most of the orthotics that we have, they make several different styles that can be used in anything from just regular athletic shoes to construction boots to high heels. There are orthotics that can be made for that. There's maybe not as many corrections that we can make with high heels. Whether a person should be wearing high heels or not. Some women will think that I'm going to yell at them because they're wearing high heels and just going to throw things off. I've had women where actually high heels probably do help correct some of the structural problems that they have as far as the curve of their lumbar spine and all that. They might have a very flat spine. They could have degenerative discs or something like that. And by actually adding some height to the heels there, it helps to restore some of the curve to their back and take some of the stress off. So everybody is individual, and that's how we look at people here. We try and look at where you're at and try and get you exactly what you need to get you back to at least a proper alignment, proper range of motion, muscle strength, function. That goes with everything that we do in the office here. So
I've heard that there's some type of option for children because their feet are growing really quickly with your orthotic company, and some type of guarantee, or they can get a change for orthotic as their foot grows. Can you explain a little more about that?
I don't have the specifics here again, but yes, the orthotic company that we use is very, very good to work with. Like if the child's foot changes more than 2 shoe sizes, they will literally remake the orthotics for your child. And I think there's just a minimal fee, or it's even free for a period of time if they do change a significant shoe size. I think over like a year period of time. So also with the orthotics in the office here, I guarantee that they're going to work for people. If you come in here, if we make orthotics for you, we're going to make sure that they work for you. And if they didn't work for you, you bring them back in, we give your money back. I don't want somebody throwing their orthotics in the bottom of a closet or something like that and letting them just sit there. When you spend good money on them, I'd rather have you have them in your shoes, get the proper correction that you need, and be happy with them there. If you're not happy with them, hey, we're going to do whatever we can. Sometimes people have problems just with their feet. We need to continue to just look at, evaluate, and treat, and deal with whatever they have going on with their feet. Occasionally, we do have problems that might have happened at the lab or something like that, and we need to get the orthotics sent back in to get further corrections made or alterations made to orthotics. But all that can be done. Usually, there's about 90 days that you get in the beginning. Most people are going to know within the first 2 weeks for sure. I would say after 5 days, most people are they're doing really, really well with orthotics. If they're having problems after that, then we need to probably look at them a little bit closer, or look at their feet a little bit closer. So
we talk about problems. What kind of symptoms might people be experiencing where you would know that they would probably need orthotics, or that they should come in and have a foot scan done?
That's actually a good question. A lot of people, they don't even know that they have a foot problem. They feel like, hey, my feet feel fine. Most people are so focused on pain. It's not necessarily, the pain is where the problem is. If we were to chase the pain, we're probably never going to find what's the cause of the problem here. A lot of people, they might come in and they could possibly have foot pain. They could have some Achilles tendonitis. They could have plantar fasciitis. They could have tarsal tunnel syndrome, metatarsalgia, which is pain up around the toes where they're attaching to the foot, pain in the foot itself, knee pain, hip pain, lower back pain. Like I say, what we look at is the whole kinetic chain, which is when we start at your feet, your weight should be distributed evenly from one foot to the other. And what we want to be able to do is make sure that that's happening. And we're going to go through and evaluate not only the bones and joints to make sure that individually everything is moving correctly, that you have the proper range of motion, the proper alignment of all those bones, but also that the muscles are functioning correctly. We take you through kind of a muscle testing screen to make sure everything's working correctly. That's a way where I always tell people they get to judge me here too, because if we find it and they got something going on, generally, if it's more a peripheral musculoskeletal type problem, they'll be able to see almost 100% correction of that on the day that we get them treated. Again, it's probably not going to last for a while here, because you're going to go and do your normal daily activities until it's supported properly or we get it rehabbed. It's probably going to go back out again, but generally that's a decreasing frequency that we see with people then as we get that corrected. So people can have anything even up to shoulder pain, then here it's actually an issue with, could be even just a short leg. Maybe we just need to put a heel lift in for a person. It's not that we need to put prescription orthotics into everybody there. And some people, if they don't have a lot of problems, I can just send them out to get a generic arch support, and we can actually, add on some things here right in the office, so you can even see what an orthotic prescription orthotic correction would be like, or if it's just minimal, that might be just good enough for you there. I guess the big thing, there are certain places in town, where you can get good care, good feet store. You're going to get an orthotic that's going to be, I wouldn't say it's measured. It's already pre-made for your arch type. It's not, a prescription orthotic. It's not like you're going to go. It's not like you go into the optometrist and get your eyes all measured and get the proper glasses that you need for yourself, or you get all the corrections in there. It's more like you're going in and buying some cheater glasses. It should be pretty inexpensive to just get a generic arch support there. If you want great feet, we can help you here. So
one of the things I'm wondering, what advice would you have for parents who maybe have children who are in sports, in dance, things where they're on their feet a lot? I'm thinking of the preventative aspect of getting a foot scan done for their children. Can you talk a little bit more about that, and kind of what are some of the things we do in the office for parents and their children?
Well, they can always bring their children in, and we can get them scanned, see what's going on. If it's just some minimal things, again, we can get that corrected, let them know exactly what maybe is needed. If they're in some of those sports like basketball that's going on this time of year, volleyball, might be something where we need to discuss. Hey, they need an orthotic here, and we can get it made, so that it's going to work for them. We want to make it as durable as possible too. Those are sports that are going to wear, those orthotics out rather quickly too. Generally, most orthotics, they're going to last for a good 2 to 5 years. Some of the orthotics that the kids might wear, we might have to put a leather top on them if they're really wearing through them, but they might just last a season. I mean, if they're really, really hard on them they're really playing hard, doing lots of drills and all that sort of stuff on the court, it's possible they might wear right through them there. So.
And is that a way for them to, if they have the proper foot orthotics in, that they can actually prevent injuries from happening?
Yeah, I mean, that's what orthotics are for. They're made to help support your foot, as far as a foot orthotic goes, in the proper position so that you don't go and injure it. I mean, obviously if you sprain your ankle or something like that, you're probably going to have to literally tape it or get some kind of a brace so that you can support the ankle properly. Obviously have the right shoes is the next biggest thing there as well. We can kind of get into that maybe on another video in the future here, how to pick out a proper pair of shoes so that, when you are getting shoes, at least you know that the shoe's going to be supportive as well. Some of these shoes, if you can bend them in half, don't buy them. I mean, you're just asking for trouble. I mean, you're asking to have some arch problems, unless you have rock solid feet, which is probably not the vast majority of people out there. You're going to end up having some problems. It might be okay if you're running, if you have some kind of support that you get, you put in there on top of it. But, like I say, just come in, we can get your feet evaluated, see what's going on there, see what's necessary. It's possible you can just buy a over-the-counter type of arch support there. And if there's any little additional things, we have all that stuff here that we can just add right onto the ones you can buy off the shelf and get it corrected, so you can see, like I say, what it's a kind of a temporary correction, what a prescription orthotic would be like. I try and get it as close as possible to what they would put in it, but you'll know for sure, once we get it in there, like, okay, yeah, I'm having less knee pain, I'm having less hip pain, I'm having less lower back pain. You also have to kind of think of it, like if you have a car, the alignment's out, you had a little fender bender or something like that. If you don't go in and get that frame straightened out, you're going to end up having problems. You get new tires for your car, similar to like getting a new pair of shoes or something like that. If they don't spin balance those tires and make sure you have a four-wheel alignment, you're going to probably not even know it, and you're probably going to wear those tires out prematurely there. Whereas if you get everything aligned where it should be at there and get the tire spin balance, you're going to feel like you're floating down the road when you're driving with that car until you hit that next big pothole around here. But
So let's say somebody listening now is interested in learning more. They want to get their foot scan. They want to see if this is something that they could benefit from. What is the process? What do they do? Is it a consultation that they set up with you, or what is the process?
If they want to just come in and get their feet evaluated, you can just call the office at 701-356-0016, and you can literally just talk to any of the staff here, they'll get you set up for a foot evaluation. Just let them know that that's what you want to have done, and we can take you through that process there, get everything measured, get everything adjusted, see if that's something that might benefit you, or if it is something that we can send you out for that generic orthotic, then we can just send you out for that and make any other little additional corrections that thanks for the thumbs up that might be needed to get you closer to the proper biomechanical alignment for your feet. So,
and what is the financial investment in just coming in to get your feet scanned to see if orthotics are right for you?
Well, there's obviously like an initial exam fee there. I mean, I think it starts off somewhere around that lower $90 range there. I can't recall exactly, but after that, most insurance companies do cover it. So we can almost get that filed for you there. Well, we do have some discount programs that the staff could inform you of to let you know if it's something that you're going to be paying for yourself, how those discount programs work as well. So I guess the other topic here today that we want to talk about that I've actually started seeing more and more just recently here is a lot of patients kind of walking in with migraine headaches. And the migraine headaches, obviously nobody likes to have a headache at all, but a person that has migraine headaches, that's actually even how I even got started with chiropractic care myself, was that I had migraine headaches for about a year, literally went through several different doctors and all that sort of stuff. Ended up having, I think the last time I went in, it was to a medical doctor, and he even looked at my throat, said, "Oh, looks like his tonsils and his adenoids look fine here," but sits down in the chair and tells my mother, "Well, let's get him scheduled to have his tonsils and adenoids taken out because maybe that'll help." And I already went over that story here before, but ended up not getting my tonsils and adenoids out, and we ended up going to a chiropractor, and in a very short period of time, pretty much got my headaches taken care of. They didn't fully go away. I think there's still some food sensitivity issues that I had, and as I still kind of continue to try and avoid those food items there, generally do not get very many migraine headaches anymore unless I get kind of lax on what I'm eating here. And that can be typical for a lot of people that have migraine headaches. They're going to have possibly different food triggers or chemicals that might trigger their migraine headaches. So, but getting back to the migraine headaches, what can we do for that? I mean, it's a vascular, generally kind of component to migraine headaches. The big thing is, there's tons of different kinds of headaches, but generally, probably the most common ones are migraines and muscle tension. And there are people that are going to have pure migraine headaches, and there's people that are going to have pure muscle tension headaches. But I think the vast majority of them, if we were to look at them on a continuum here, I'm going to get my fingers right here. You're going to literally see on the one end of the spectrum, there's probably only 5 to 10% of either that are probably pure muscle tension or pure migraine there. The vast majority of them are going to have somewhat of a mixture of the two. So definitely, for sure, we can help people with that muscle tension aspect here. Then it's a matter of maybe helping them trying to find out what are some of those triggers that are causing some of the vascular episodes for them. We've also gotten a new therapy in the office here, which we just started to utilize with people here. Still kind of waiting to see how it is helping with the migraine headaches. I've just had a few in now, and we're just watching them to see if it's been helping out. But it actually helps to increase the blood flow throughout your body by 30%. It's called PEMF therapy. Anybody, if they want to kind of come in and test that out, we'll let people try that for 3 sessions just to see if it might be something that could help you. So again, if you want to contact the office at 701-356-0016, you can come in for your 3-visit trial there to see if that might be something that could help benefit you. Not only with the migraine headaches, it's also good with a lot of other vascular things. Swelling in the legs. A lot of people that have diabetes and circulatory type problems. This helps out a lot. In that, I've seen people now with circulatory issues in their legs, and it's pretty much within a couple of visits taken a lot, if not almost all of the swelling out of their legs. They were probably more in that mild to moderate category, but it's crazy just how it helps increase that blood flow for them. So getting back to the headaches though, besides literally looking at that vascular component, we literally are going to go through and do a screening of the patient there, double check like the range of motion, make sure they have the proper range of motion so everything's moving correctly. make sure that they have, the proper muscle strength in their neck. If something does show up that ends up being weak, again, that's one way where we can retest that stuff as far as make sure they have proper range of motion and muscle strength after their visit. And that's what we're watching long term with them to make sure that we're getting back full range of motion, full muscle strength. We'll also look at general function, and we have some tests in the office that we check with that as well. So if anything is still out of whack, that's typically where most insurance companies will cover up to, is getting that proper function back. Once we're to that there, then most people are probably off onto, either a PRN type basis. So they're coming in, usually we'll try and give them a few things to kind of watch for. If they start to notice that they're starting to get some tension in their neck, it's starting to lose some range of motion, it's best to get in then. So it's only going to take a visit or two possibly to get them back on track to where they should be at, and hopefully maybe abort a migraine there. Migraines are tricky though. If you let them go a little bit too long, I'm sure most people who have migraines know that it's hard to get them to stop. Some of the medications that they have now, a lot of the medications are just covering up the symptoms, and then you have to have it with you all the time. Imitrex or something like that. You start to have a headache. You're going to take some Imitrex to try and stop the headache there. Like a lot of those people, if we can sit down, get some of the muscle tension aspect cleared up for them, it just makes it much less of a chance that you're going to aggravate the vasculature there. Also, if we can kind of help them figure out maybe what food triggers they might have, there's lab tests that we can do, and we can go over that. Usually it typically ends up being foods that they tend to kind of crave when they do have a headache, or when the headache is over. It's like, oh my goodness, I'm feeling better, I'm going to have some chocolate or coffee, or it could be various different things. So and then we can just help them find those out. Then that vascular component can say somewhat quelled down and decrease that frequency of the headaches in that as well for them. So anything else that you have? Anybody else have any questions? I got about 4 people on here. Hi, Gil. Hi, Greg. Hi, Vicki.
So if people want more information, one of your things with being a full body chiropractic office is that, you had talked about the nutritional testing or the food allergy testing, that might also be a cause of their migraines. So basically what you're saying is there are a number of different reasons why people are getting migraines, and what you do is you try to, find the core problem of what is going on. It may or may not be muscle tension, it may be something else, but in the end that you have the options to find out what the core problem is.
Yeah, typically, if you're going to treat it more on a symptomatic type basis here, you're never going to get anywhere. So if you're just trying to cover up these migraines with the medications there, you're not fixing anything. You're just trying to stop something that's going to be there, and you've maybe resigned that it's just going to be there for the rest of your life. Most of the time, that doesn't really have to be the case. It's possible, but we can get down to finding out what the root cause is there, get some of those lab tests ordered if that's necessary there. We use an outside lab. We even have people go outside to get that blood drawn, so we have really nothing to do with it here. We'll go over everything with you that you might need to get done and get that outline for you. Even any treatment that we might need to do in the office, we'll sit down, we'll lay all that out for you there, so you know what it might take to get it done, how long it might take, how much it might cost, so that way there's no surprises for you there in the end. Besides that, we have different other things that we can get into in the office here. Some more what we term functional medicine types of things, where we might use some other nutritional things to kind of help deal with the symptoms there, because even if you're taking certain medications, those medications might even be causing issues because they'll deplete some of the vitamins that you really should have in your system. And if we can sit down and look those up for you there, even with that, maybe if we can get you going on something just to help clear up some of the deficiencies that you're having with the medications there. So, if you're a good doctor, we want to try and find out what's causing the problem here. We try and look at it from a whole body perspective, full body perspective here. So not only do we want to get those migraines to go away, but we want to make sure then that structurally everything's kind of lined up where it should be at. You have the proper, range of motion, muscle strength, and function. And once we have that back, you should be pretty rock solid and not have a lot of problems there, unless there's some other underlying, metabolic conditions that are going on. And with that, that's where the lab test would help out a bit. Or obviously we'll find that out, when you fill out some of the paperwork here in the office, and we can kind of address those on an individualized kind of basis. So if you do have any questions or any further things here, you can always leave us a message here on the Facebook webpage for the business. If you'd like to come in for a consultation, you can always contact the office again at 701-356-0016. You can go out to the website, which is just drpaulbeckum.com, drpaulbekkum.com. All the other contact information there. There's plenty of other information on the website as well. We're now trying to add more and more information all the time, so you can always keep checking back there. We added a new chat feature there, so you can even, if you don't want to make a phone call, you can always chat with the staff, and they can get your questions answered for you there, get you set up for an appointment. So I hope everything was informative for you there, and I think we'll be signing off. Have a good day.